Hello, I'm Laura Jost with the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. With a month left in President Obama's term, CMS isn't slowing down with the transition to value-based care. This week brought final word for new bundle payment models for cardiac care, expanded bundles for joint replacement, and a new track in the Medicare Shared Savings Program. The changes will give more doctors a chance to select the Advanced Alternative Payment Model path, one of two choices under the Medicare Access and Chip Reauthorization Act, or MACRA, which takes effect January 1st. But the American Hospital Association thinks CMS is moving too quickly, and President-elect Donald Trump's nominee for Health and Human Services agrees. Georgia Congressman Tom Price wrote this in a letter to HHS in September concerning the Center for Medicare and Medicaid Innovation. We insist CMMI stop experimenting with Americans' health and seize all current and future planned mandatory initiatives. For more, visit ajmc.com. The American Journal of Managed Care this week published its 6th annual special issue on health information technology. Special guest editor Dr. Joshua Vest of Indiana University, Purdue University, Indianapolis, writes that health IT is at a point of transition, as the wave of setting up systems is over. Now comes the hard part, making technology deliver better care. Vest and his co-authors write that it's time for health IT resources to align with the demands of population health. To realize this alignment, healthcare leaders must think differently about the types of data their organizations need, the types of partners with whom they share information, and how they can leverage new evidence-based partnerships for evidence-based action. For the full issue of Health IT, visit ajmc.com. The new issue of Evidence-Based Oncology looks at efforts to expand palliative care, which has been shown to improve quality of life and even extend it for patients living with cancer. One challenge has been moving palliative care beyond hospitals and into community oncology practices. EBO contributor Sharon Pierce, the Vice President for Public Policy of the National Hospice and Palliative Care Organization, writes about important shifts that are allowing tests of palliative care in community settings. A CMMI demonstration project seeks to give more Medicare patients access to the hospice benefit by allowing them to receive palliative services while still receiving curative care. Pierce writes that finding qualified providers is also a barrier. Hospice and palliative care professionals require a multidimensional set of skills, attitudes, and competencies, including the ability to manage the myriad symptoms associated with advanced and comorbid illnesses, the ability to facilitate communication and problem solving between patients, their families, and their care teams, and the ability to coordinate and provide team-based care across a range of settings. For the full issue of Evidence-Based Oncology, visit ajmc.com. Diabetes advocacy groups celebrated this week when the FDA approved a new use for Dexcom's G5 mobile continuous glucose monitor. Patients can now make dosing decisions using the CGM data without taking a finger stick test several times a day. The change may lead to Medicare coverage for CGM, which until now has not been deemed necessary. And this week, the American Diabetes Association released its 2017 update of the Standards for Medical Care in Diabetes, which put more emphasis on lifestyle management. The ADA called for interrupting long periods of sitting every 30 minutes and for doctors to pay close attention to disrupted sleep, since this is known to affect blood glucose levels. Lifestyle management will be on the agenda at Patient-Centered Diabetes Care, our annual multi-stakeholder meeting set for April 6th and 7th in Teaneck, New Jersey. For more information and to register, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.